Is this your best position? Speculum, right?
It's inside. It's expanding, you guys. It's expanding. What's up, it's Germaine, and today we are on ground at the Singapore Cancer Society Clinic, and I'm gonna be getting a Pap smear. Now, I'm very, very sad today because my girls cannot be here with me, so I decided to use technology and bring them in on a live journey.
Hi! We miss you, Germaine!
I miss you girls so much too, but you know what? Even though we are apart, we have to do our iconic intro. Are you guys ready?
Alright!
Hi everyone, and welcome back to another episode of...
Okay, we wanted to get a Pap smear done together, but because of the measures, we were unable to. So three of us also host a podcast called The Hush Podcast. And on one of the episodes, we spoke about period health and stuff like that. And I shared with them my experience on Pap smears. And that was when I realized that these two girls have not gotten their Pap test yet.
Guilty as charged, but at least one of us is getting it today, and Germaine's gonna take us through her entire journey of the Pap smear.
I'm feeling a bit nervous, a bit excited, but you know, having you girls here with me, it just makes me feel so much better. I don't know how much you're gonna see of everything today, but I feel like we're gonna be very, very good friends after today.
No boundaries!
Secrets.
But I do have one question for Hazy. When you went for your Pap smear, right? Were you prepared in the sense that you waxed, shaved, or you went for laser treatment?
I wasn't. Okay, let me explain myself. I went in thinking that I was just gonna go for a normal consultation with a doctor. I did not know that I could get the Pap smear done there and then. So I was not prepared at all. But I think the doctor has seen like enough vaginas in her life. She didn't seem to care. So I'm like, okay, let's get it done.
Was a bush, everybody, it was a bush!
It was a little bush, a little bush.
But you know, Pap smear is one of the best tools to detect pre-cancer and early stage cervical cancer. So very important for us to learn.
That's right, and I think growing up, we didn't have much information on this. No one really spoke to us about this. We didn't know where to turn to for information as well. So we hope that, if you're in the same boat as us, this video will help you. So we're going to find out all about Pap smears today. Why is it important? Cervical cancer, how can we prevent it? And even things like, what's the prime age that you should be doing this test and jabs?
Exactly. So without further ado, girls, I'm gonna bring you into the clinic with me and the whole crew as well. And we are gonna open up my cervix and see what's in there. Woohoo!
Let's go!
I wanna tell you where it's at. I wanna get that, baby. I wanna get that. Mama wanna tell you where it's at. I wanna get that. Get that.
Hello, say hi to Dr. Rauzana.
Hello.
Hi, doctor.
Hi.
Hello. I am very nervous. This is my
Yeah, I understand
first
it's your
time.
first one, right?
Yes,
first
it's my
time,
first
right?
time.
So most patients are nervous, and I will advise them to relax, okay, and just focus on deep breathing.
Okay, deep breathing.
You'll be fine.
Like when you're giving birth. So
Congratulations, you've taken the first step in
I
making,
know.
this screening against cervical cancer.
exactly. I think a lot of our viewers of Hush Hush deserve to know how important a Pap test is.
That's right.
And at my age, around 26 years old, this is when you should be getting the
That's
test.
right. A lot of times, right, they would procrastinate. Okay, so it's good if you have friends who encourage you and give you the, the support, right, to ask you to come. So taking action is the first step.
But my friends want to see my vagina. How?
Doctor can or not, doctor?
So how long is this procedure gonna take?
Less than a minute.
Less than a minute? Oh, that's very fast, huh?
Very fast. Over before you know it.
For first timer, right, this is how the procedure is like.
Okay.
So I'm going to use this instrument. It's called a speculum. Okay, we use the plastic disposable ones. Okay, can you see this looks like a duck?
Are you gonna kill me, doctor?
Not to worry. Okay. So I'm going to insert this gently into your vagina, like so. All right. So I'm going to open it up slightly so that I can visualize your cervix. Okay. And then I'm going to use this soft brush.
There's something else. Something is going in.
Okay, so I'm going to use the soft brush, right,
Okay.
to take a sample of cells from your cervix. That's all very fast.
It's like a swab test,
It's
but
like
for
a
your
swab
vagina.
test.
Yeah.
Your cervix.
Well,
Your cervix.
I guess you can put it that way.
Okay, so the sample will then be sent for
Yes,
testing.
that's right. The sample will be, put into this specimen bottle,
Okay.
which contains preservative solution. It will be sent to the lab.
I see.
Yeah.
Interesting. Okay.
So I just need to find out, right, whether do you have any other medical history such that you need any long-term medication,
Oh, okay. Not right now. I have nothing.
any previous surgery,
previous surgery? No, as
how
well.
about other gynecological conditions?
No, none.
No, none.
Thankfully,
Okay.
because I never go and test, so I don't know.
Have you had your HPV vaccination though?
I have not had my HPV vaccination, and I know you have to get it by 26, right?
If you want to get the subsidy, but otherwise, yeah,
Oh.
there's no need to. Right, so if there's no issues, we can proceed with the test, okay?
Okay. Okay. Guys, we are about to start. Dr. Rauzana, my cervix is in your hands, literally. Okay, so I'm gonna lie down right now. A bit nervous. There's a nappy pad in case I pee on the bed.
Okay, so I need you to lie all the way near the edge of the bed.
Oh, lie to the edge of the bed.
That's
okay.
right, and put your feet on the stirrups. That's right. Okay, ready to roll?
My legs.
I can't imagine how insecure Germaine must be feeling right now. Like, you know,
I'm
spreading her legs
okay.
open with like cameras,
Not the first time.
Ready?
So I need you to relax, okay? Drop your
Okay.
knees to the side as much as you
Yep.
can, all the way to the side.
Oh, all the way to the side. It's like I'm getting a Brazilian. But not.
Okay,
But not
relax,
really.
huh?
Okay.
Is this your best position? Your
Oh,
best? all
this
the
is
way
my
down. Very
best.
good.
I'm a dancer,
Okay.
doctor. I can
Oh,
stretch.
actually, okay. Okay, so just focus on your breathing. Take slow,
Okay.
deep breath.
The speculus is
In and
going in right
out.
now. What is it called?
Speculum. Speculum. Alright, so I'm just putting it inside.
It's inside. It's expanding, you guys. It's expanding. Okay. Okay, I think the
this is right.
sample stick is inside. I can feel it scrubbing against my cervix.
Is it uncomfortable?
It's not. It's just a bit of discomfort, but not so pain. It's out already.
It's done, but I just need to do a quick examination to check your uterus and your ovaries.
Oh wow. Okay. Let's do that.
Quick one, yeah? Okay.
I'm feeling okay. It was very
Relax
quick. But now she's doing a check of the
It's a
uterus.
manual examination.
It's a manual examination.
By manual, so I'll check. Okay.
She's pressing
Using
on
both
my
hands.
womb
Yes,
and
that's
ovaries as.
right. Okay, great. That's all.
Oh, that's all.
That's all.
All right. So we're done.
Nice! Good
with the
job,
whole
Germaine!
testing.
Good job!
Thank you so much, doctor.
Welcome.
So, Dr. Rauzana, thank you so much for making me feel so comfortable with the whole procedure. How soon can I expect to know the results?
Usually we will mail the results to you in about 4 to 6 weeks' time. If there are any abnormalities that requires further investigation, I'll give you a call much earlier.
I see. Okay, so 4 to 6 weeks time, you get sort of a report telling you the levels.
That's right. You will get the report, the laboratory report, as well as a notification letter to tell you when to do the next test. So if the results are normal, it will be 3 years. Okay. If there are some perhaps inflammation or some infection, you may be asked to come back earlier, say about 6 months to 1 year.
So, doctor, I just want to have a chat with you
Okay.
today to understand a bit more about, Pap test, Pap smear, HPV. So, firstly, what is a Pap smear?
So what you underwent just now, right? So Pap smear is actually a laboratory test whereby the pathologist examines the cells that is taken from a woman's cervix. So the pathologist will examine the cells, right, and look for any abnormal changes in the cells, which may signify early changes that will lead to cervical cancer.
And doctor, I have a question. So what is the difference between HPV and Pap smear?
Okay. Right, so HPV test and Pap test or Pap smear, right? Basically, the procedure is the same, exactly the same, only in the lab. So in the Pap smear, they'll be looking at cells, right? Looking for abnormal changes. But in HPV test, they'll be looking for the virus itself, the HPV virus.
Doctor, before going for a Pap smear, is there anything that needs to be done? Any preparations?
Okay, good question. Okay, when we want to take the cells from the cervix, we want the cells to be as clearest and cleanest as possible. So it's best to schedule your Pap smear 2 weeks after your first day of your menses, if you're still menstruating. For women who have attained menopause, then they can do it at any time.
Okay, so this is basically a model of what happens to your cervix when you've got cervical cancer, right?
That's right.
Okay.
So the normal cervix is as such, right?
This is the normal cervix. Okay, nothing is here. It's all good. Okay.
Sometimes you may have benign growths like
Okay.
this. Okay, it's called a benign polyp. Okay, which is easily visible. And this is early, what we call non-invasive cancer. Okay, it has involved, slightly bigger circumference. So this is early stage invasive cancer. It means that the cancer has spread, all right, beyond the external surfaces of the cervix, and it has gone through the deeper tissues. And this is the later stage invasive cancer. It may have invaded to surrounding tissue, including your vagina and perhaps your womb as well.
Yeah, this one looks very, very scary.
Yes.
Okay.
Yeah, it does.
So in the early stages, you may not have symptoms, okay? Perhaps maybe down here, all right, when you have any symptoms like postcoital bleeding or bleeding after intercourse, you may have abnormal bleeding in between your menses. So when you have these symptoms, you need to see a doctor urgently and get investigated.
So Doc, this is really why regular screening is so important. So to wrap things up, right, I have a few myths that I want to ask you. And my very first myth that I've got here, I can't get HPV if I have just one sexual partner. But before Doc, you answer my question, what do you girls think, Germaine and Zura? Do you
False.
think it's true or false?
I think it's true.
I think it's false because
Really? But if you have just one partner and you each have just one partner, where's the virus gonna come from?
each have just one partner. Wow, I don't know.
Okay,
What's
doctor.
the answer?
So the answer is false. Your risk may be lower compared to somebody who has multiple sexual partners, but low risk doesn't equal to zero risk, you see? So you still need to get screened.
So I have another myth actually. If I've gotten my HPV vaccine, I don't need to get a Pap test.
Interesting, skip the
No,
pep
but
test,
it's
just
like-
get the vaccine.
If you already got your COVID-19 vaccine, you still need to get a COVID swab, right? If you still want to find out. So I'm gonna go with false. Women that have the HPV vaccine, they don't need to go for a pap
False.
test.
False.
Oh, but I thought there were 3 vaccines in total, so I thought it was pretty like well-rounded and stuff. Like
Yeah, it's 3 doses over 6 months. It's the same vaccine over 3 doses. However, it doesn't cover all strains of HPV or the high-risk HPV. At most, it only protects you 70 to 90%. So there is still that 10 to 30% that you need to screen.
Okay, so we have just one last myth here, which I feel like we know the answer after today. Cervical cancer cannot be prevented. Girls?
False.
10.
So the answer is
Very can.
very can. So cervical cancer can be
Can be
prevented
prevented.
with
Pap test, regular screening, your vaccines.
Healthy
Don't smoke
lifestyle.
so much. Yeah, limit your sexual partners.
Oh,
Eh?
correct.
Doctor, you've taught us so well. I feel like, after today, Hush is an expert on HPV and cervical cancer, and we can go and spread the word.
Oh, thank you so much, Doctor, for your time and for
Welcome.
spreading, so much knowledge to us and our viewers. We really appreciate it.
That's right. And when Hazelle and Azura come by, for their individual pap tests, Dr. Rauzana will take such good care of you guys.
Please do. I'm scared.
Don't be scared.
Alright, so with that, it's very important, all the information that we learned here today. What do you want to tell, our viewers of Hush Hush?
Okay, 2 things. All right. First, book your appointment to get your HPV vaccination with your family doctor. Okay, and book your appointment as well to go for cervical screening. You can come here to our clinic, SCS Clinic at Bishan. We provide cervical screening at no cost.
So if it's gonna be no cost and no charge, what are you guys waiting for? It's better to be safe than to be sorry. Alright, thank you so much, Dr. Rauzana, for your time. We hope to see you very, very soon, especially Hazelle and Azura.
Thank you, Doctor. See you soon, okay?
Much.
So thank you very much for joining us on this episode. It's a very special one because it's the last episode of the season of Hush Hush. Very, very
So
sad.
fast.
Yeah, exactly. It really was so fast, and we decided to do something special to bring you to go see my vagina.
But in all honesty, 8 episodes of Hush Hush so far, we have been through so much. Beauty hacks, tips and tricks, speaking with professionals like the Dr. Rauzana today. I feel like, maybe sometimes we seem like three basic bitches, but we really, really enjoyed every single episode with all of you guys. And thank you so much for being with us every step of the way.
Yeah, and we really do hope that if you're watching Hush Hush, you have been supporting Hush, we hope that you feel less alone, especially growing up. I think a lot of us felt very alone, very confused. Hopefully we were able to help you, and we will always be your big sisters no matter what. And with that, thank you very much for watching Hush Hush. Make sure to, follow us on our YouTube, It's Clarity Co, as well as our Spotify podcast, Hush Podcast.
This is the end of an amazing season. Thank you so much.
See you guys.
See you again.
Bye.
Nipple, for the nipple, for sure.
Seriously?
When you wear the dress,
But
it's metal. That's true. Cut that out. My trusted friend.
Your trusted friend?
Because when I
We are not your trusted friends.
Alright, congratulations, Azura, you won this dildo.
I send you video.
Okay.
Wow. Cannot lah, seriously. 2021 already, please don't wear this lah. It's a no, my friends. It's a no.
Thank you for watching this episode as well, and we'll see you next time. Bye.